Students, welcome to lecture 12 in hospital pharmacy, and as we were discussing the chapter purchasing, distribution and inventory control of medicine, in that series we are discussing the last topic, and that is distribution of medicine. For today's lecture, we will be covering the topics distribution of drugs to inpatient, to outpatient, and distribution of controlled substances. So all the topics would be revolving around distribution of drugs to various areas of the hospital. So first of all, what distribution is actually? Distribution as a very integral part of dispensing. As you know that in a hospital setup, usually it is dispensing it is distribution part which makes the dispensing of a hospital setup from different from normal community dispensing. And why this step is involved in a hospital setup, the basic reason is that from central pharmacy or from various satellite pharmacies or whatever distribution mechanism is being adopted by that hospital, uh, the drugs are distributed to various areas, including inpatient, outpatient, or many other areas where it could be required. So distribution becomes a very important and integral part of dispensing being carried out at a hospital. So as we just discussed, main targets of distribution in a hospital are inpatient, outpatient, ambulatory patient care, and controlled substances distribution. So distribution to inpatient, first of all, we take it into consideration about discussion. Inpatient are those patients who require hospitalization. Those patients are brought to the inpatients who need hospitalization. Simply, it means that their case is more complex. It needs more care and more vigilance on the part of healthcare team to get the patient stabilized, to feel stable about their health. So definitely they need hospitalization. There are 4 ways in general for dispensing to inpatients: individual prescription order, complete floor stock system, combination of individual and floor stock system, and unit dose system. So students, as you remember that this particular topic we already discussed in up to detail in our last semester, and in upcoming slides, I will go through these various topics in a superficial way just to recall the memory which you already learned. And in this way, you will learn that how the distribution happen in a hospital. Individual prescription order system. So what happens in this system? It is a type of prescription system where the physician writes a prescription for individual patient who obtains the drug prescribed from any medical store or hospital dispensary by paying on charges. So what is the advantage point of this system is that all medication orders are directly reviewed by the pharmacist, because the prescription after being written by the physician or doctor is brought by the nurse to pharmacist for dispensing purpose. Now pharmacist has full authority to review the prescription and to look for any mistake if there. And moreover, the pharmacist then dispenses, and that medication is supplied to the respective ward or the inpatient um, through suitable distribution means. And so in this way, this system provides the interaction of pharmacist, doctor, nurse, and the patient in a very coherent way, because the pharmacist can be in coordination with the doctor. Nurse brings a prescription, so nurse is in direct coordination or collaboration with the pharmacist. Then pharmacist can not only visit the ward or the inpatient uh, to check what is the condition of the patient or how the drug is being administered to the patient, uh, but can also telephonically call and ask or suggest if any changes he or she wants. Moreover, this system provides a clear control of inventory, which is a very good aspect of this distribution system. So students, we just discussed in case of prescription order system that drugs are prescribed by the physician. That prescription comes to the pharmacist on which the dispensing is made. Now what happens in this case, in case of complete cross-talk system, prescriptions do come to the pharmacist, and then what happens that drugs are usually provided to the patient to the nursing station or being supplied from the drugstore hospital, and in this case, selectively the prescriptions will be given to the pharmacist actually, and usually a small bulk of drugs is being supplied to nursing stations, which are usually present on the inpatient or ward floors. Drugs being supplied to nursing station or ward are divided as charged for stock drugs and non-charged for stock drugs. Then comes a combination of individual and closed stock system. So students, as we just discussed that in case of individual prescription order system, which can be considered the best system, but the combination of individual and closed stock system also works in a very good way. In case of individual prescription order system where the prescription is coming directly to the pharmacist and the bill is being done, and then after that dispensing is being made to the inpatient. Uh, what happens in case of a closed stock system is skipping a step of pharmacist involvement. Pharmacists are usually not considered for review, we can say, and which often results in too many drug-drug interactions, too many mistakes, too many problems associated with prescriptions, and which also result in more cost to the patient when more cost-effective drugs are not suggested by the pharmacist as an alternative during the prescription review. So the combination of individual and closed stock system is followed in the government and also in private hospitals run on the basis of no profit and no loss. Now how it works, its adaptation could be different and depends upon hospital from setup to setup. But overall, the concept of this system revolves around the fact that though the individual prescription could be conveyed to the pharmacist, but along with that, um, there is a possibility that patient is directly purchasing those items of drugs which are required or surgical items. That list is being provided to the patient, and it is up to the patient whether they purchase it from the hospital pharmacy or from outside, and then they are providing it to the nurses, to a registered nurse at a nursing station, whether that ward or inpatient. So, and along with that, the hospital also maintains a certain amount of nursing station or drug supply to the nursing station in a proper way. Not to the extent as in case of closed stock system, but this system also is a combination of both. So you can see that this system is more adaptable, more easily carried on, and it helps not only in management of the cost of the treatment, it's good for the patient, it's good for the hospital as well. Then comes unit dose dispensing, and generally you are aware about this mode of dispensing that in this method the medications are provided in single dose units and for using once. So that is a general definition or a possible description of unit dose dispensing. But if you look at its definition, those medications which are ordered, packed, handled, administered, and charged in multiple of single dose units containing a predetermined amount of drug or supply sufficient for one regular use. Uh, so generally you are aware that when um, you are aware of the concept that units in multiple of single dose units, administered, handled, packed. Everything is usually being in single dose units, multiple of single dose units. And a single dose unit package is one which contains one complete pharmaceutical dosage forms. Better financial control, it prevents loss of partially used medications, it does not require storage facilities at the nursing stations. So these are few advantages of unit dose dispensing, and till now it has been considered the best dispensing mode. And it is very beneficial to the patient, it is beneficial to the hospital, and though it overall increases workload, no doubt. But if that is manageable, then unit dose dispensing is the best one. Now comes distribution to outpatient. So outpatient refers to patients not occupying beds in hospital or in clinics, health centers, and other places. It simply means that patients do visit a hospital, but they are not occupying any place within a hospital for a longer time period, so that it requires hospitalization or a bed allotment to the patient. Outpatient has three categories: emergency care, tertiary care, and primary care. Emergency. So in emergency, person is given emergency or accidental care for conditions which require immediate medical attention, suffering from serious health conditions or illnesses. So primary care is a majority care, you can say. It describes a range of services adequate for meeting routine health care. It doesn't cover major health ailments or major health conditions. It only covers routine health affairs and any counseling if you require, or routine health issues if you're facing, like flu or a little bit infection which you are facing, or if you need um, boost to your energy, or similar conditions which you face on routinely basis. That's why it is a primary care, which is a majority care. Patients are ambulatory and free in their movement. They are not supposed to hospitalize. They are not being sent to other specialized treatment areas. They are just checked and being rendered with services whatever they are asking for. So primary care is a very simple sort of health care. Tertiary care, if you look at it, is the attending medical practitioner may direct the patient to another specific outpatient department for more specialized treatment. Means it is not the general condition or routine care or health condition, but it requires more specialty, and secondly more intervention by a specialized expert treatment. So it would require more facilities, more equipments, and a specialized treatment. So that's why it's called tertiary care. Now, drug distribution for outpatient. And students, if you remember, we already discussed dispensing to outpatient, and distribution, as you are aware, is just part of dispensing. So we already discussed it in detail. So right now I'm giving a recall of various steps that might be a preliminary steps to distribution or related to outpatient distribution. For example, it means outpatient pharmacy should be located on the ground floor of the building. The pharmacy receives its supply from medical stores weekly, but emergency supplies can be obtained at any time. So here it is mentioned that it is the ground floor, but it's not necessarily. Maybe it is not that many floored building. So basically, the outpatient's location is in such a way that the going patients easily get the medication and they just can easily go away, as it doesn't require them to stay or any hospitalization. So outpatient's location matters a lot, because there is this idea that hospital outpatient is not only bound to supply medicine to the patients of the hospital, uh, but any patient from outside can also avail their services. So their location must be in such a way that going patients, leaving the hospital patients, and the patients from outside, who might be called the outsiders, can easily visit them and avail their services. Prescription is a must for issuing the medication. They must see the uh, prescription and then they will be giving the medication. Once supplies are issued, their quantities are recorded, and medicines are given to the outpatient from the pharmacy situated in the outpatient block. So that is the main thing which is related to drug distribution, that the central pharmacy would be supplying the medicine to the outpatient, which would be in the outpatient block, and definitely they could use and various services for and various means for distribution of medicine, whatever specific setup that hospital has. Now coming to distribution of controlled substances. So usually for its direct responsibility for the proper safeguarding and handling of controlled substances within a hospital is upon the administrative head of the hospital. Safeguarding in a way that it doesn't go in wrong hands and it is not being exploited. The staff is not doesn't find any chance or is in a position to exploit the medicine, controlled substances in their hands to supply to wrong people. So handling of controlled substances and safeguarding both are equally important, and so usually the accountability is directly upon the administrative head of the hospital. Usually in case of managements of the other medication, usually the chief pharmacist will be responsible, but controlled substances management and especially their safeguard and proper handling is direct job and responsibility of administrative head of the hospital. So there is a format for issuing the controlled substances, and it's issuing by the pharmacy. Usually, first of all, a requisition is made for controlled substances. It is never like the pharmacy is supplying the controlled substances to the wards or to the patients directly or to the nursing stations. Though there is a supply of controlled substances, but that is necessary, essential, and a vital supply, and that could be needed in emergency situation or in some immediate situations, but that is not linked to the day-to-day distribution of controlled substances which are being asked by the physicians for the patients, and so or which is direct part of the prescription. So usually the prescription or ordering by the physician of controlled substances is never direct, but it is on a specific requisition form, and a requisition for controlled substances which includes their name, strength, and form of controlled substance, means dosage form, in what form they are being delivered. That is written and then it is forwarded to the pharmacy. It is done before any new issue of controlled substances. Or the physician may order a certain request form. If requisition is taking time and there isn't a proper availability in the nursing station as well, then in that situation physician can order directly on a certain request form, which could be different from requisition form. Most common drugs of abuse, which are usually abused in a hospital, are pain relievers, including opioids and narcotics, including oxycodone with brand names of OxyContin and Percocet, hydrocodone, codeine, and morphine. Then there are central nervous system depressants, like including the sedatives, tranquilizers, and hypnotics, barbiturates with the brand names of Mebrol and Nembutal. Benzodiazepines, which you're well aware, are usually available with the brand names of Valium, Xanax, and Lexatinil. Then there is stimulants. Apart from pain relievers, central nervous system depressants, stimulants have the potential to get abused by the patients. So stimulants used to treat attention deficit disorders narcolepsy, and weight loss. So these are the main reasons for which usually the use of stimulants is started, that it being basically used to treat attention deficit disorders or narcolepsy and weight loss. Then the example is dextroamphetamine, for example, dextrose, and methyl phenidate or Ritalin. So these are the few common drugs which got the potential to get abused in a hospital if it is not properly safeguarded and doesn't being handled in a proper way. So daily controlled drug administration sheet, as you were discussing that when it is ordered by the physician on a requisition form, or for example, the direct request is being made by the physician, then it is after their supply and distribution. There is, for their control purpose, basically a daily controlled drug administration sheet is developed, and though it is being made or prepared after their distribution, but still it is part of distribution, because it is in connection to that. It is very important to develop such a list whenever such a distribution is made, in order to keep a record for future purpose. So that daily drug administration sheet includes certain information, which is, for example, date at which it is being administered, amount given, patient's full name, patient's hospital number, name of doctor ordering, signature of nurse administering, frequency and route of administration. So these are the important information which must be there, and you can see that it is encompassing all those which were involved in its order and whoever is administering. So usually this is a complete record: who has this drug has been delivered to, administered to, who was doing it, and who was the physician who was doing that order. So this is the crucial information which is recorded on the drug controlled administration sheet. Then comes requisition form. This is a sample for requisition form, and the important points which should be over there on a requisition form. So you can see what detail is usually given, and then the number of tablets, capsules, or whatever unit dosage form you're ordering. Usually the controlled substances are supplied in unit dosage forms, like ampoules, tablets, capsules, and then after their number, there would be a column which would be giving the drug name, their dosage form, and strength. And in another column, price could also be given, but that definitely would be recorded by the pharmacist after the proper review of requisition form. So this is a sample of requisition form. And physician order sheet is another option which can be adopted, and in case requisition form is not being used for some reason. So the physician order sheet will also include certain information, and the important one is date, patient's full name, patient's hospital number, specified description of drug order and strength, amount to be given. And this order sheet is also important to get signed by the physician, whoever is ordering that medicine. So students, this was end of the chapter, and I just hope that till now you people would be able to touch on various parts of purchase, inventory control, and distribution of drugs. We can go in further detail, but I think time doesn't justify that. Secondly, it won't be justice with other chapters, because we already allotted too much time to this chapter. So this was end of the chapter. Inshallah, in next lecture, new chapter would be started.